Hi, my name is Destiny Thurber. I'm going to be performing my trach care suction video today following my general principles and safety practices. I'm going to knock, introduce myself, explain the procedure to the patient. I would use 2 patient identifiers and assess for allergies. I would assess for pain. The patient is not in any pain today. If she was, I would administer pain medication following my 11 rights and 3 checks. I'm going to do hand hygiene, and I'm going to start out with a respiratory assessment. I have a pulse ox on the patient's finger. Alrighty, I would also listen to the bath. The patient's breathing is labored and the lungs are gurgling. The pulse ox is reading 90 and the respirations are 16. Okay, I am going to perform hand hygiene and place this over my patient and put this on. I'm going to turn on the oxygen, and then I would turn on the suctioning. For an adult, no more than 150. For an adolescent, no more than 125. And for an infant, no more than 100. I have an adult, so it is on 150. I'm going to perform hand hygiene and open up my sterile kit. Okay. I'm going to pull out this box, open my saline, flip it over the trash, pour that in there, perform hand hygiene again, making sure to stay in the 1-inch border, open up sterile gloves, now that my sterile gloves are on, step back in, grab my sterile packaging, now I'm going to take this hand and grab this and undone that hand. And this hand is no longer sterile. I'm going to connect this. Alrighty. Now I'm going to check for suctioning. Okay, it is good. I'm going to hyperoxygenate my patient 3 times. Ready? Now I'm going to go in until I meet resistance. Okay, and we do not suction until we're pulling out. 10 to 15 seconds. Alrighty. We could do this up to 3 times. In between, if she needed it, I would hyperoxygenate again before I did another pass, but she does not need another pass. So I am going to remove this. would discard all this in the trash, remove my sterile gloves. Okay, I'm going to perform hand hygiene. Now I'm going to do a respiratory assessment again. Ready? And I would have listened to the back as well, and put a pulse ox on her finger. Now it is reading 98. The lungs sound clear, and the respirations went up to 18. I then would report and record hand hygiene and come back and evaluate my patient.